Here I am again, Dr. Rick, in my very glamorous basement, talking about Para-Eya and the International Health Service of Minnesota as we're getting ready for our next trip to do some training for the local doctors and nurses in cervical cancer screening with direct visualization with acetic acid. That's a very formal long name, but it's pretty straightforward. And with each student that we certify, they leave with a kit so that they can return to their home area and continue this type of screening for their patients where they live. And it's a pretty simple kit. You will need a speculum that's coming from one of our other great donors. And then we'll just spray the cervix with some vinegar, which we'll get there. And then we'll have to wait an honest minute here with a timer, which will work in the dark, even when there's no electricity, and when there's no cell service, and when there's no nothing. But as long as you have gravity, those are going to work. And then while you're watching what you're doing, you really need a headlamp to see where you're going. And these are the donated headlamps that will be going to each student. There's even a green filter for better visualization of aberrant blood vessels across the cervix. So, really simple kit. Does a magnificent job, as good as or slightly better than the old smearing of the pap smear on the slides with visual look under the microscope. So can do a really wonderful job for taking care of patients in Honduras, where the #1 cancer killer of women is cervical cancer. It just shouldn't be, and we're going to do our best to make sure it doesn't continue. Thank you.